Hello and good evening, and welcome to the Functional Solution class brought to you by the American Academy of Functional Health. My name is Tal, and I'm joined by my wonderful co-host, Dr. Chill.
Hi, everybody. Welcome.
So hopefully you're having a good week so far, and a nice evening. I know we're trying to kind of bundle up here in the Northwest, where it's getting more colder, more windy, more rainy. How are things over there in San Diego?
It's getting colder, not windy or rainy yet, but
Yes.
I'm sure we'll get some of that. But people are starting to wear sweaters.
Wow.
I know, right? It's a major change.
Yes, absolutely. Yeah, my wife always looked at me at leaving the house, and I'm bundled up with the sweater, the coat, a hat, and she looks at me like I'm going hiking in the Everest or something.
You're
Right?
ready for Alaska.
Yes, exactly. So yeah, so hopefully wherever you are, the weather is either nice or you are nice and warm and bundled up. So we are very excited about today's class. We are going to actually dive into the integration of functional medicine into primary care, and more specifically for patients with autoimmune conditions. So if you want to learn more about the root causes of chronic diseases and really learn the practical, which is what we do best, evidence-based strategies, then you're in the right place. Now, the reason why we picked autoimmune conditions is because of the ongoing growing burden that takes place with autoimmune conditions. So there's, for example, one report published by the National Institute of Health just recently, 2023, reported that more than 50 million Americans live with an autoimmune disorder, at least one. And most commonly, of course, as we know, that's Hashimoto, rheumatoid arthritis, lupus, multiple sclerosis, psoriasis, or inflammatory bowel disorders, right? So there's multiple types of autoimmune conditions. We know that this is a very important topic to talk about and learn more strategies in a functional or integrative approach, right? One is because the prevalence is very high. Second, the current therapies have some drawbacks that I'm sure many of the patients are aware of, and many of you as practitioners are already aware of. But for example, one of the major drawbacks is the common side effects, right? So when you look at corticosteroids such as prednisone and those types of medications, we know that fluid retention, weight gain is an issue. There's concern for higher blood pressure, elevated glucose, osteoporosis, right? Higher infection risk, right? When we look at biologic medications, we're looking at different reactions at the injection site, upper respiratory or opportunistic infections, right? And then a little bit more rare neurological malignancy risk. Now, the third reason why we're looking at what other tools can we offer, can you offer as a practitioner to your patients who are struggling with autoimmune conditions. The third reason is because the high cost of those medications, right? So when you look at biologicals, for example, there was a report by the American Autoimmune Related Diseases Association. They reported that biological therapies can cost between $10,000 to $30,000 per year. And that's sort of an estimate. We've talked to practitioners previously that reported that their medications are much higher than that. But the average out-of-pocket expenses that was reported, at least in 2022, is between $4,000 to $10,000 annually under Medicare Part D coverage. So even with insurance, copays, deductibles, it remains a significant barrier for so many patients, right? So if we can help our patients to improve their health, find the root causes, and then reduce the flare-ups, then we can help save them a lot of money on these biological medications or side effects of the variety of medications that are available. Save them money, save them the suffering, right? And reduce the potential side effects or complications, right? We know that we often don't talk about the complications, which is you can see with some conditions, right? Like the rheumatoid arthritis patients that have their joints are already deformed, right? And that's really unfortunate when a patient gets to that place, because it's in many cases unreversible, right? And that's why I've also invited Dr. Chill, because I've been in the sort of integrative, holistic, functional field for about 20 years. Dr. Chill has years of clinical experience as a functional medicine physician. And I want us to have this discussion and also share with you, the root causes, some strategies, integrative strategies, so you can already from tonight take with you for the next patients you're going to see this week or next week. But Dr. Chill, we know that autoimmune conditions are a challenge, right?
They are, and you kind of nailed it in the beginning when you were talking about the increased prevalence, right? I'm overseeing a lot of patient cases with the practitioners within this academy, and you would be surprised at how many practitioners are seeing their patients and their antibodies. They're running thyroid, right? Or they have a patient who has hypothyroidism, and you would be surprised at how many times those patients, their antibodies weren't run. And when the practitioners, from a functional medicine perspective, starts to run those antibody markers, they're seeing so many of their patients being not diagnosed properly. And many of their patients are having this autoimmune condition. And many of their patients, even though they're on medications like levothyroxine for their hypothyroidism, they're not feeling any better because they're missing a key component here. And it's looking at their autoimmune component. And this is why this is such an important topic, because from a functional medicine perspective, there's so many things that we can do as practitioners to help these patients really heal and also bring down those autoantibody responses, right? Bringing down that inflammatory immune response as well. And one way to do that, we can go back to food as medicine. Dietary considerations, nutrition really matters with the patients who have autoimmune susceptibility or are diagnosed with an autoimmune condition. There was a study that was published in the Journal of Nutrients, and this was done in 2022. It stated that dietary patterns rich in anti-inflammatory, right? Because we're as functional medicine practitioners, we're constantly investigating areas of inflammation, and we're looking at different approaches to bring that inflammation down and that chronic inflammation down. Nutrition is a go-to for that. It should be our first go-to as practitioners. And there is a specific diet. I actually don't really even call it a diet. I call it a way of eating. And it's the Mediterranean diet, right? Or it's the Mediterranean approach to eating. This has been shown. There are myriads of studies with the Mediterranean diet and its anti-inflammatory, antioxidant information on bringing down inflammation, and then also supporting things with better outcomes with autoimmune conditions. We're also looking at omegas and excess omegas, and in particular omega-6s, right? There is, for the standard American diet, many of our patients are eating a ratio where the omega-6s are at an unhealthy level, and they are creating inflammatory responses for our patients. And many of the omegas that your patients are on, they're coming from things like processed foods, And these processed foods are going to drive up those omega-6s, and they're going to drive up the inflammatory cytokines. What we should be looking for are things like the Mediterranean way of eating and adding in things more like the omega-3s. These are the anti-inflammatory omegas because they have polyphenols, they're rich in they're fiber-rich foods, and they're healthier for the microbiome. There was another study that was published, and this was in 2017. It found that participants who improved their dietary quality, and this is just by adding in more fruits, vegetables, whole grains, while reducing the refined, simple carbs, right? They had a significant reduction in inflammatory markers and things like C-reactive protein, also IL-6. We constantly talk about this inflammatory cytokine IL-6. They doing things like adding in more fruits and veggies and whole grains reduce these cytokines. So many patients, when you talk about diet, they get worried that you're going to be taking and restricting so much of their food. It's really surprising when I start talking about the Mediterranean way of eating, and I'm actually adding in foods for the patients. The patients' eyes just go wide, and they're really excited about it because they're thinking that they're going to be restricted. And with doing something like the Mediterranean approach, you're actually adding in more food for them, right? You're adding in more vegetables, more fruits, more nuts, more whole grains, the specific types of carbohydrates. And this is really beneficial for them. So let's take a look at an image here. And this is going through the specific types of foods, specifically with the Mediterranean diet on rheumatic and thyroid autoimmune diseases, right? So as we see on the left-hand side here, we also want to take a look at environmental factors for our patients. That's a part of the holistic approach, that comprehensive approach that we do as functional medicine practitioners. You want to take a look at what types of pollutants they might be exposed to, if they've had past infections, if they've been on antibiotics even in the past, because that can have an impact on the gut. It can also have an impact on hormones, right? Things like even UV radiation and smoking. And then there's also genetic factors. It's really epigenetic factors that we're looking at from a functional medicine perspective. And then this image is showing what the Mediterranean diet can do, or the Mediterranean way of eating can do. It can help to improve the patient's inflammation, oxidative stress, the chemostasis, disease outcomes, right? It has antioxidant defenses. It improves thyroid functions. It improves T regulatory cells, which helps to decrease those things like the IL-6 that I mentioned earlier. It helps to improve disease symptoms. It helps to improve short-chain fatty acid balancing, which improves our microbiome balancing. And if you've been in these podcasts, you know how important the microbiome is in all and overall health for our patients. So this is just one aspect that you can look at for your patients who have autoimmune conditions. And this should actually be the first thing that you look at with your patients. And this brings me into our first pop quiz. So this is according to recent research, which we just showed you here. Which of the following dietary patterns is most effective in reducing inflammation and improving autoimmune outcomes? Is it A, diets high in omega-6s and refined carbohydrates? Is it B, the Mediterranean way of eating, which is rich in omega-3s, polyphenols, and fiber? Is it C, high protein, low carbohydrate diets emphasizing processed meats? Or is it D, diets focus on calorie restriction without regard to nutrient quality? I'm going to give you a few moments here. The answer should pretty much stand out to you. I've been speaking about it for the last 10 minutes here. If you answered B, the Mediterranean way of eating, rich in omega-3s and fats and polyphenols and fiber, you answered correctly. That is what we're looking for. And you could do variations of the Mediterranean diet, right? So There's vegetarian approaches to the Mediterranean way of eating. There are things where you can take out certain aspects and add in more polyphenol rich nutrients for patients as well. So you can play around with the Mediterranean way of eating for your patients.
One of the things that I'm so glad that we kind of started a conversation with dietary, right? Because diet is the foundation and of good health. And as we kind of go deeper in our class today, talking more about functional medicine, right? And we often use the term root cause, right? And what's interesting is that based on so many calls we make with primary care practitioners, every day we have a whole team of admission advisors, and they have calls every day with people who are interested in our advanced programs. And interesting, it's this concept of really trying to understand the concept of functional medicine, right? And you might say, well, functional medicine is functional medicine lab testing, right? And that's maybe one aspect of functional medicine, right? Some might say, well, functional medicine is like integrative medicine, right? It's like diet and herbal medicine and stuff like that, right? Botanical medicine, all that stuff, right? And that is definitely it's not typically a part of functional medicine, but we also teach that. Like, we're going to talk about diet today, we're going to talk about supplements, all of that, right? But the essence of it, it's really interesting because I had a call with a physician just this morning, right? And I asked him about what made him interested in functional medicine, and we had this really interesting conversation. He was like a super nice guy, working with lots of autoimmune patients. And he was interested in joining our community. He said, like, okay, he checked us out online. He saw some of our reviews, testimonials, and he's like, I saw that you guys like do a lot of the clinical stuff, and I really like that. And I told him, great, yeah, absolutely. And we're definitely going to take you deeper into understanding the root cause. He's like, what am I going to learn, right? And I was like, well, we're going to go deeper into the root causes. We'll definitely cover the labs, and then you'll have a mentor like Dr. Chill, Esha, or Dr. Kim. They'll work with you. And then something came out. It was really interesting. He asked me, so what are we learning in the first few modules? And I said, well, the first few modules, like typically the second module to module 14, in the first 3 or 4 months, we covered the whole root cause, right? All the different root causes. And he's like, Tal, isn't the root cause like you guys have already like figured out the root cause? He's like, and he didn't mean to sound kind of cynical about it, but he's like, you guys have, there's like medicine has been around for like, for a long time, and you guys have already kind of feel like you figure it all out. And it was really interesting. So it was a really interesting conversation because to a lot of practitioners, the root cause is like either it's the patient genetics, because that's what they learn in medical school, right? Or the root cause is idiopathic, like it's unknown, right? Like this is what essentially I asked him, well, what does root cause mean to you when you see an autoimmune patient? He said, in most cases, unknown, idiopathic, right? I'm sure, Dr. Chill, you had like, if you've been working in collaboration with different physicians.
Yes, absolutely. It's surprising what they're thinking as the root cause of issues are. I was like, oh, actually dive deeper and a little bit deeper. And that's what we do as functional medicine practitioners. We dive to the very, what is this primary root cause? What is the major contributing factor here to all of their conditions and to all of their imbalances, right?
Exactly. And that's really where, the conversation was interesting, and it's kind of like we were saying, right? We already know it, because once you go through the training, you're like, oh, I understand. Like the most common thing I hear from physicians going through our programs when I talk to them later on is like, I don't understand why they don't teach us this stuff in medical school, right? It's like, that's like the number one thing I hear, right, from a lot of practitioners. And so I'll give you sort of the short version of what I believe functional medicine is. And that's, in one word, it's like epigenetics, right? And to me, essentially, epigenetic is really the science of everything externally and internally that turns on genes on and off, right? Kind of like a light switch on the wall, right? And of course, the medical term is like upregulate, downregulate, or increase the expression of certain genes. But essentially, that's all it is. So today, when I speak to primary care practitioners, I use the term epigenetics more because it's essentially, we know that in the care, in the frame of what it is that we're doing, or primary care, we're not changing the patient genes, right? But what we are doing is, with functional medicine, is we can better understand the epigenetics, better understand, look at the patient, look at the environment, look at their internal environment, and see what it is that they're doing to themselves that is turning those genes of disease. And that's why I feel like opening the conversation with diet is one of the most important thing. And I'm so glad that you did that, Dr. Chill, because it's, the foundation has to be there, right? If you are prescribing a certain medication, prednisone or a certain biologic or whatever it is, to an autoimmune patient, and they go home and they keep eating diet that is inflammatory, like it's high on omega-6, low on omega-3, right? So the ratios are off. They don't consume enough fiber, so they don't support their fermentation process in their gut bacteria, right? If they are consuming high amounts of sugar, if they're exposed to chemicals, like all of that stuff, if they're doing that, right, it's very counterproductive to what you're trying to do with a prescription, right? So this is why it's so important to understand. And the more you go into, in our training, the more you go into the nutritional medicine, the more you understand how you can actually change patients' health and function by even doing applying small strategies in nutrition. I've seen that over 20 years. Like, I've seen people that they don't need as much medication anymore. I've seen patients that, their inflammation and pain reduced. I've seen patients just by changing what they're doing to themselves all day, which is they're eating inflammatory food, sometimes 3 times a day. They don't even know it, because they think that some of them even think they're eating healthy, right? But healthy, as we dive into more and more clinical nutrition, you'll learn that, there's different types of healthy, right? Healthy food. And some healthy foods, considered foods, are not always healthy. So that's why I'm so glad that we started a conversation. So the 2 takeaways that you want to have is omega-3 is really important. Reduce omega-6. Fiber is really important. Polyphenols in fruits and vegetables are essential, right? So that's something that we want all our patients to be on. Dr. Chill, what are some of your what is one of your best strategy to help patients to increase their, for example, consumptions of phytonutrients?
Yes, it's starting small, right? One thing at a time, adding in one fruit or one vegetable at a time, and speaking with the patients and collaborating with them, right? This should be a collaboration between the patient and the practitioner. You should ask them what they're capable of doing. And there's going to be some patients that are like, I can completely switch my diet or the way I eat entirely right now. And then there's some patients that are like, oh, this is going to be really difficult for me to do. So you start slow and steady with them. The biggest thing that you want to do with those types of patients is start slow and steady. Start with adding in a couple of cups of leafy greens every day, right? And switching it up here and there every other day, and providing them with a handout on how to do it, or an app on how to do it. Just just trying to make it as easy as possible for the patients will go a long way for them.
Absolutely. And I'll add a couple of strategies that I found to be helpful. One of them is looking for, like you said, sometimes it's not taking away something from them, because that feels like, food, our dietary choices they're so deeply tied to our maybe the way that our memories, right? So we used to sit as family and your parents made you a certain dish, right? So you have those, it's associated and so strongly connected with family memories or friends, or there's a certain way that the smells or the flavors kind of remind you of something, right? Also emotionally, right? Sometimes we all have it when we sometimes eat more emotionally, right? We pick foods that are more comforting, right? So I found that sometimes it's easier with patient to not, instead of taking away something and saying, I want you to cut all fried food and all this, and you got to cut this, and you got to cut meat and all that stuff. Instead of that, maybe saying something like, here's a simple way to add phytonutrients, right? Can you add, if you'd like to drink coffee in the morning, can you add a couple of cups of green tea, for example, after, in the afternoon, right? For example, after your meals, right? So that's something that we're just adding on, simple, that we're adding on to add some phytonutrients. Maybe instead of cooking with canola oil, cook with olive oil, right? Instead of, and then another little kind of pro trick that I found is that who's cooking in the house, right? That's a simple question to ask each one of your patients, right? Like, who's cooking in your household, right? And if it's their spouse, it's sometimes easier, sometimes harder. But if you tell the patient, next time you coming in, can you bring your spouse with you? Can your spouse show up with you, right? Sometimes getting in the spouse involved, right? I had many cases where I had patients and I knew that the diet conversation is going to be really hard. So I kind of leave it to the end. So I just say, you know what, for now, can you add a couple of green teas every day? And we're going to talk about supplements soon to help to support whatever we're trying to do. But next time, can you bring your spouse with you, right? And then when their spouse is in, I'm going to have that conversation of, would they be able to help them with introducing the salad, for example, for dinner or something like that? So if their spouse eating it, they're giving it to them as well. Sometimes that works better, right? So involve the spouse, the support member as well. So with that being said, now let's continue to strategy number 2. And we're talking about, when it comes to autoimmune condition, we're talking about functional immunology. So understanding immune imbalance is very, very important, not just in the biology one-on-one aspect that you learned in nursing or medical school, but from a functional point of view. And so it starts with the simple details on how the inflammatory cytokines like interleukin-6 or tumor necrosis factor alpha, they drive tissue damage. Now, here's something really important to understand. There's a vicious cycle, and this is probably going to be a reminder for some of you, and some of you might already know this, but when we have ongoing inflammation, that leads to oxidative stress, which means more reactive oxidant species, right, than antioxidants. It's a state in which we've got a lot of free radicals going in our body, and they're just destroying our cells, right? They're messing up with our DNA. They're causing cellular and organ damage or tissue damage, right? That leads to more inflammation. Our immune system responding to that as if, wait a second, there's damage here. I need to reignite the inflammatory process. So now you got, again, oxidative stress and more inflammation. So it's kind of like a vicious cycle. And then we're looking in functional medicine at what can we do to selectively lower some of these inflammatory cytokines. And of course, what's triggering it, right? So diet is one, environmental factors is one, right? There's different things that can trigger that. But for example, if we look at, there's multiple strategies that we can learn, right? There's like in the advanced program, we actually learn probably 7 or 8 different ways that we can reduce inflammation. And that could be inflammation in the gut, that could be inflammation in the brain, like neuroinflammation, that could be general systemic inflammation, right? So it really depends on what it is that we're trying to do. There's ginger, works different than boswellia, works different than omega-3, works different than curcumin, works different than, right? So each compound works differently in our body. But let's take, for example, something that we can all consider as a very well-known compound, and that's curcumin. So curcumin, according to a study published in the Frontier in Immunology in 2022, found that curcumin supplementation increases the T regulatory cells, right? So it increases the anti-inflammatory cells, Treg cells, and it selectively reduces the pro-inflammatory cells, which are interleukin-6, right? Now, we're gonna post here the specific study, so you can read more about it. This was published in Frontier in Immunology in 2022. But the really interesting part of it is that curcumin is really one of the simplest and affordable strategies we can use, right? And I give you an example here of one professional grade supplement company. And by professional grade, I mean they have third-party lab testing for purity. They have years of good reputation, right? And there's third-party testing that are done periodically to ensure that this is what's on the label is what's in the capsules, right? So you can see here there is 500 milligrams of curcuma longa, and the dosages really depend on what type of condition it is, right? For example, with some autoimmune conditions, if we go in just to supporting the reduction of inflammation, maybe 1 capsule a day could be beneficial, right? That's all the way to some conditions like osteoarthritis, right? That might require 1,500 milligrams a day, and that's what studies are comparing it to medication, to a group of patients on, let's say, ibuprofen or other medications that will require a higher dosage, right? And so I want you to notice also another thing, which is this particular product has bioperine, black pepper extract, and it's a very small dosage. It's like about 5.3 milligram. And what this does, it helps with increasing the permeability of the gut for increased absorption. Now, here's a pro tip. If you have a patient with inflammation of the gut, let's say inflammatory bowel disease, then utilizing curcumin in an oral consumption is very effective. And in that case, I will probably pick a product that do not have black pepper, right? Because I want a very local, specific reaction to the GI, right? However, if I want curcumin, which by the way has low bioavailability, so it's low, the absorption is low, right? If I wanted to have a systemic approach, systemic impact, I have to combine with it a certain compound or agent that will increase permeability, right? And that's the reason why I'm showing you this product with black pepper extract. So you now understand already, just by spending a little bit of time with us, you now understand the difference between a product that just has curcumin and a product that has curcumin with black pepper extract, right? One is for local GI, very specific for the GI. The other one is more specific for a systemic approach. right? So now you're starting to think more like a functional and integrative medicine practitioner, right? You're starting to look at the whole picture, and now you can kind of design or personalize the treatment protocol. So next time you got a patient coming in and let's say they have rheumatoid arthritis, and you ask them, what are you taking? And they say, I'm taking curcumin. Ask them, does it have black pepper extract? If it doesn't, they might probably benefit, according to many studies, they will probably benefit more from a product that has black pepper extract, and taking it together to get that more systemic impact, right? So with that being said, let's go into pop quiz number 2. Which of the following statement best reflects current understanding of chronic inflammation and immune modulation? A, chronic inflammation mainly affects the joints and does not influence other organ system. B, inflammaging refers to age-related weight gain rather than immune dysfunction. C, persistent cytokines such as interleukin-6, tumor necrosis factor alpha contribute to tissue damage and oxidative stress, while curcumin help regulate immune balance by increasing T regulatory cells. D, curcumin increases inflammatory cytokines to strengthen immune defenses. So which one of the answer is more accurate? I'm going to give you guys a few seconds. We talked about curcumin quite a bit. We talked about how curcumin works, right? What exactly, when you go into the pharmacology of curcumin, what does it actually do, right? For patients, more specifically for patients with autoimmune conditions, right? So the correct answer is C, and that's persistent cytokines such as interleukin-6 and tumor necrotic factor alpha contribute to tissue damage and oxidative stress, while curcumin help regulate immune balance by increasing T regulatory cells, which reduces, right, helps us to keep a more anti-inflammatory balance by reducing the pro-inflammatory cytokines. So now, of course, every time in our specialty classes, every time we go into the treatment protocols, we learn, okay, well, curcumin or this or resveratrol or other what do they do for metabolic conditions? Now, maybe your patient have autoimmune conditions related to the brain or neurodegenerative conditions related to the brain. So now we're looking at different protocols for neuroinflammation, right? Compounds that maybe cross the blood-brain barrier, right? So this is the cool part about functional medicine, right? It's not just learning the root cause and look at fancy labs, right? It's really understanding how are these compounds working, and how can I take the right compound and match it to what's going on physiologically in my patient's body, right? So we got a lot of these different, and you're gonna learn about all the different treatment options. We got clinical guides, like we got coaching with Dr. Chill. That's why we have all of those tools, so you can start literally from your first or second month in the program, start using everything to help your patients. So, Dr. Chill, I know that we talked about a few really important factors, and now we're getting to something that also really important factor in our patients' lives.
Yeah, absolutely, because it's a comprehensive approach, right? As functional medicine practitioners, we want to utilize all of these different approaches. So we talked about nutrition being the first approach that we should be utilizing. Then we can look at things like supplements and personalizing that supplement and the compounds specifically for what's going on with the patients, what's going on with their lab results, what's going on with their specific imbalances. As Dr. Cohen was saying, everyone's going to be different. They're going to have different imbalances. They're going to have different contributing factors to their imbalances. How do you match the specific compounds with supplementation to the specific imbalance, and how do you prioritize that? And that's what we kind of go through with you in our coaching sessions. We'll go through how to look at prioritizing that information for your patients. And that brings us into the next approach that you want to also consider adding in for your patients, which is going to be lifestyle interventions. This is all meant to help with reducing inflammation. With lifestyle interventions and autoimmune conditions, what we really want to look for are how is the patient sleeping and what are their stressors. Obviously, we can look at labs, and we'll go through that in the advanced program. So make sure you go into the HPA Access modules. You go into, there's case studies on sleep as well within the advanced program. So make sure you go and check those out. But what we want to look at are these two specific factors as a starting point with your autoimmune conditions, as with your autoimmune patients, because this does have a profound impact on the immune regulation. There was a study done by New York Academy of Sciences that talks about sleep and stress and how mindfulness, meditation, social connection can reduce these inflammatory responses in autoimmune patients because it helps to rebalance the immune function. And that's what we want for our autoimmune patients, right? So when we're taking a look at their stressors and their sleep, we should be asking this within their intake. We want to look at some ways that you can improve that for them. And one simple thing that you can start to add for them are things like a 5-minute mindfulness activity, or a 5-minute meditation, or a breathing activity that they can do, right? A breathing practice that they can start to add in. And this can start to help with not only improving sleep, but also reducing that stress response, that cortisol response, that HPA imbalance that's happening. And then another study that was done, this was a randomized control trial published, and this was done in the Journal of Clinical Medicine in 2021. It showed that patients with SLE, or systemic lupus, this is a form of an autoimmune condition, they completed an 8-week mindfulness-based stress reduction program, and they experienced greater improvements in their quality of life, pain management, and this was compared to the controls. So not only do we have an approach to look at their nutrition, or a tool to look at their nutrition, we also have tools to look at their supplementation and specific compounds and personalizing this. And then we also want to add in the aspects of lifestyle interventions. The stress, sleep are two important lifestyle factors that we really want to consider for autoimmune patients. And we're going to kind of wrap it up for you in how this works in functional medicine, right? A lot of practitioners want to understand how to put this, how to put the information that they're learning within this program in their day-to-day, in their clinical setting. And there's a way that you can look at that. There is a framework that you can look at. And this goes back to what Dr. Cohen was saying. Dr. Cohen, you were talking about epigenetics and chronic diseases. And now we kind of have a framework that we can teach practitioners on how to utilize the functional medicine framework in addressing those epigenetics.
Yes, absolutely. And sleep is one of the one of the most important things for recovery, right? But as you mentioned, in more specific with there are really interesting studies that physiologically showing us, like you mentioned, that if your patient is not sleeping well, it will have such a massive impact, negative impact on their immune system, right? Now, of course, in the advanced functional medicine program, we dive deeper into the physiology of melatonin and cortisol and their impact on the different inflammatory cytokines in our immune system, and how can we help our patient to regulate their sleep to get better quality sleep, right? So quality and also quantity. Those are two very important factors. One of the things, one of my go-to is always to tell patients to try to avoid staying late and watching TV or their phone at least an hour before they go to sleep. It's, of course, harder to do. It's easier to say that than actually to practice. But I also take advantage sometimes of people's desire to to use apps, right? So we're very conditioned to use, for example, using apps, right? Because it feels like it's easier to just use use our phone, right? So there are a couple of apps that you can recommend, you can consider recommending your patient. One of them is Calm, so it's just CALM, so just Calm. And essentially what it is, it's an app that has it's free, so we're recommending things that are free. The Calm app, essentially, it's the free version has basic breathing exercise for immediate relief from stress. So you can look into download the Calm app. And then the other one is Breathe Work, which is Breathe WRK. And there's access to sleep or stress management, some guided classes. And again, there's a free access account that your patients can of course benefit from. Dr. Chill, what is your kind of major strategy to help patients with stress?
Yeah, I mean, I love these apps, right? Another one that you can look into is something like Headspace, because they have a free version as well. And they're 2 to 10-minute sessions, right? And they're guided. So there's a lot of patients that don't know how to start with meditation or breath work or mindfulness. You can do these apps and they can be guided for them. And you can start with as easy as doing 1 to 3 minutes a day, and just starting there, right? And once you start doing it, your mind is going to start to want to do it more, because you're going to start to feel and see the effects of it, not only from better sleep, lower stress levels, but your conditions start to improve as well. You start to get more energy. And that's just all from breath work or mindfulness or meditation.
Yes, absolutely. And it really doesn't take, it doesn't take, very specific type of, a lot of people think that they have this association with meditation. I got to light on some candles and be in the atmosphere. It's like, and it's really all about like putting your phone down like 10 minutes before you go to sleep and just sit there. And then just think about your breathing. You don't even have to do anything special if you don't want to use any apps. Just sit there. Let your brain, it's all about allowing our brain to process the massive amount of information that we have been absorbing all day, right? The events of the day, the emotions, the things that they might be lingering stress from getting stuck in traffic on the way back home, right? There might be some lingering stress from a conversation that we had, or an upset patient that was upset or something like that, right? So, or maybe things are not going as well as we wanted them in a certain time and place, right? And so that is one of those things that you do not want to take with you to your sleep, right? Because it's better to allow our brain to process it before you go into sleep, so you get a more restorative rest, right?
Yeah, and all you need to do is focus on your breath. That's it.
Yep.
And you could do that for a couple of minutes while you lay down, and that can help to reset your mind and your nervous system.
Exactly. So just as simple as focusing on your breath, letting those thoughts come and go is perfectly fine. Even if you got a troubling thought popping up in your brain, it's okay. You just breathe, you acknowledge, and then you move on, right? As simple as that. So that was the third strategy that we talked about. We're going to talk about the fourth strategy, and the fourth strategy is, of course, a more functional medicine framework, which we talked about, the epigenetics. So we're going to mention those briefly because we have classes that go in depth into each one of them, modules that go in depth. So one of them is gut health. So just as an example, there was one study published in the Annual Review of Nutrition that highlighted that if your patient has intestinal permeability or bacterial dysbiosis, it can contribute to immune dysregulation. Same thing with environmental exposure. If your patient is exposed to heavy metals, mold, other toxicant, endocrine disruptors, it can cause immune dysregulation. Same thing with cellular dysfunction. So we actually have two very highly recommended modules inside our advanced program that in my opinion, every practitioner should watch at least once. And one of them, the first one, is the cellular and mitochondrial dysfunction, which essentially shows you what happens when under certain conditions, your cellular energy production is not working properly. That leads to more reactive oxygen species that disrupts the immune function. And then, of course, the second one is diving deeper into the different lab biomarkers and treatment protocols. So more specifically, like what do I actually do when I test my patient, look at the organic acids, what do I actually do with the patient to help them to improve that cellular function. And that's a big game changer, especially if your patient is experiencing chronic fatigue, some mental cognitive decline, or other symptoms such as muscle weakness. So all of those, we want to start looking into what's going on in the energy production in the cells, right? And optimize that. So there are other factors in of course, with functional medicine, functional endocrinology, for example. Dr. Chill mentioned HPA axis, but those are, I mentioned 3 or 4 of the most important ones. And that leads us to pop quiz number 3. And then we're going to put it all together for you. So which combination of underlying factors must contribute to immune dysregulation and inflammation? Which of those underlying factors most contributes to the immune dysregulation? A, balanced gut microbiome, nutritional sufficiency, and mild stress exposure. B is genetic predisposition alone without environmental influence. C, low fiber diet, regular exercise, and adequate sleep. D, intestinal permeability, environmental toxic exposure, and mitochondrial dysfunction. So if you so you should know this. It's pretty straightforward. And the answer is D, intestinal permeability, environmental toxin exposure, and mitochondrial dysfunction. So Dr. Chill, I feel like this is where putting it together is always the fun part, right? Because it's like, okay, we talked about this strategy and this strategy and this strategy. Now tell me, how do I put it all when I'm seeing my patient tomorrow morning?
Right. Exactly. How do I put it in the clinical setting, right? And this is what we go through in our coaching sessions with every practitioner, is to because every visit is going to be slightly different. And we'll go through how to kind of personalize all of your visits for your patients. But there is a flow that you can look at following, right? This is the clinician's flow for integrative care. So now that we understand all of these strategies, the way to put it together is to first evaluate everything, right? You want to look at what are their underlying factors. We can evaluate things like what is going on with their lifestyle that's happening that might be putting them into an imbalance. What are some environmental things that they may be exposed to? What are other factors that are influencing their condition, right? That is evaluating. Then next, once you figure that out and we have tools that can help you evaluate what their underlying factors are, the next thing that you can do is educate them on what's happening. You're going to explain what all of the root causes are, or all of the contributing factors to their underlying imbalances. And this is going to help the patient understand exactly what's going on. And your patients are going to love you. The biggest thing that we often hear in functional medicine is that from our patients is that this is the first time with the patients saying this is the first time that they felt they were listened to. And when you are educating the patients on the why, your patients are going to feel listened to. And when they feel listened to, they're going to be empowered to do whatever you say. And they're going to be empowered to really start to improve their health in all of these different strategies that we're talking about, right? So now that we've evaluated what is going on and we've educated the patients on the whys of what's happening with them, we can start simply with your patients, right? You can provide something that's actionable, like a lifestyle recommendation or the nutritional recommendations, right? Something like the mindfulness that we were talking about. Then we can go into the fourth aspect, which is the dietary guidance or the nutritional guidance, with offering one or two simple solutions that they can start to add in. It's not necessarily take away. We want to focus on adding for them in the beginning here. And then you could go into different supplement strategies and personalizing those supplement strategies based on their imbalances, right? You want to start with maybe recommending one general supplement and then 1 to 2 targeted supplements. We don't want to throw everything at the patient, right? We want to personalize this based on their health goals, what their needs are, what their imbalances are. And this allows us to properly monitor our patients and what's going on so we can make the necessary adjustments. If you throw too many supplements at your patients, you're not going to know which supplement is working, which supplement isn't, which supplement you need to be adjusting. That it makes it really difficult to monitor with your patients. And that's the main framework of everything, right? Evaluating, educating, and adding in all of those different strategy components that we talked about and making it as easy as possible for your patients.
Yes, absolutely. And I love the picture that kind of shows us the simple steps, right?
Mm-hmm.
It's the first one is look at the epigenetic factors, right? Now, when you're in the advanced program, we already do the hard lifting for you. So utilizing the evaluation tool, give it to your patient, ask them to fill it up before they're coming into the next session. And when you get the results back, right, we give it to you as a PDF. The patient can fill it up, save it, and then upload it to the EMR. Or for older patients, we used to print it in our clinic.
Mm-hmm.
Used to print it out, give it to them and say, fill this up at home, come back next time a few minutes before your appointment to allow us to review it. And now where you're reviewing it, you're like, oh, they got high symptoms, high amount of signs and symptoms in the bacterial dysbiosis or heavy metals or nutritional deficiency or certain neurotransmitter imbalance or HPA axis, right? That from there helps you to say, okay, these are the top 2 things I want to focus on. I'm going to look at my clinical guide. And in my clinical guide, what is the top treatment strategy or supplement or lifestyle something, or what is the lab that I need to talk about or order, right? So, and that's exactly why we also have the clinical mentors like Dr. Chill, Dr. Esha, Dr. Kim. They can go with you over it. And when you bring case studies, either yourself, family member, a friend, real patients that you're starting to use these methods with, just book a call. We are covering the cost of it. It's part of your program. Book a call with the mentor and the clinical mentor, and we'll help you we'll help show you how you can put it all together very quickly, right? But as Dr. Chill said, it's very simple. It's like you pick like, okay, one supplement, one this, one this, one this, one this. You can even do like in this session, I'm just gonna pick like to talk to them about like one root cause, one supplement to reduce inflammation, and one dietary guidance, right? Next session, 2 weeks later, how everything went, get some feedback. then apply, okay, what's the next supplement I can talk to them about, more specific to maybe their autoimmune condition, maybe rheumatoid arthritis or Hashimoto, whatever it is. And then what is one lifestyle strategy that we can integrate now for the next 2 weeks, right? So it's almost like you're building it very slowly. Every time you see them, you just build it. You ask, you get their feedback, because we're doing it slowly, not just to not overwhelm them, like Dr. Chill mentioned, but also the real goal behind all of this is not just temporarily reduce their inflammation, reduce the exposure to the insulting factors, but we are trying to create habits that will follow them for the rest of their lives, right? Because that's what we all want in our heart. That's what we all want for our patients. We want them to get better and carry on this work, right, for the rest of their lives. I also love it, and I'm sure, Dr. Chill, you had that before, but I love it when patients come back and they say, oh, I didn't know this about sugar. I've been giving my kid, this cereal in the morning. It has tons of sugar, right? I didn't know about this processed food, or I didn't know about this, or I didn't know about that. And now I changed my family also diet. So my kid is doing better at school, right? It's like,
it's the best when they start participating in their health, right? And they bring you certain things and they say, hey, what are your thoughts on this? And now you're having a collaboration with them in their health, right? And again, it goes back to them feeling empowered. At the end of the day, it's always about them and how they're going to get better.
Absolutely. And it's one of my favorite things to do is really patient education. And I feel like that's probably one of the reasons why we have a lot of nurse practitioners and registered nurses in the program, and also pharmacists, because patient education is like so natural to these professionals, right? It's like empowering and providing information to the patient that is useful. It's valuable. It could be health changing or life changing. That's really what they've been doing since like pretty much the day one, right? It's like taking care of the patient directly and educating them, talking to the patient, actually having conversations. But it's the reason that the way I see it is really, one, when you provide this valuable information and guidance that they're not going to get anywhere else, right? You are becoming a very valuable person in your patient's life, right? Because now you are the source of information for all things health and wellness related, right? They're not going to get any of that stuff with any other primary care provider, right? Now, of course, we need primary care. We need primary care for the management of the conditions, the prescriptions, the adjustments over time of the medications, right? That's very much needed, but that's not going to get them healthier, right? In fact, based on the surveys we're seeing, over time, many patients continue to lose their health, right? So that's why that's the value of what we're bringing, is like health and vitality, helping them understand how to take care of themselves. And then, of course, providing more natural solutions, more integrative solutions. And this is why they pay you, right? This is why when you look at some of the practitioners in our community that work with Dr. Chill to build a practice, we just started our practice accelerator, a new class for the practice accelerator this month. And we're diving this month every Monday evening, more specifically into building a practice. So that translates everything you're doing into profit, right? Like from $200 to $1,000 to $800 or $1,000 per session. We literally have people like Gina who are charging $850 per session, right? There's programs, there are memberships. So the more you dive deeper into functional medicine and use it and integrative medicine, one, you're going to change your patients' lives. And that's a legacy by itself, which is something to be very proud of, right? When you do that. The second thing is, if you want to translate that into more revenue, then we can help you do that as well, right? That's where we have all of this. But the clinical side is very important. Like we got to know how to help them with these strategies, right? And Dr. Chill, you talked about the how to work with patients with a moderate or higher budget, moderate budget or low budget. You already covered that?
No. So there are certain, obviously you're going to have patients in all different types of budgets, right? And this is the beauty of working in functional medicine. You'll be able to adjust it. And again, it goes back to personalization. If you have, let's go to our topic, autoimmune conditions, right? If you have patients with an autoimmune condition and they have a lower budget, right? You can start with things like, that's foundational, affordable strategies such as dietary changes, hydration. You'd be surprised at how many patients are not drinking enough water and drinking clean water. You want to look at their sources of water. That's something simple that they can look into doing, right? Looking at their sleep routines, adding in basic supplements like a vitamin D to help with the antioxidants and inflammation, or things like even magnesium to help with so many different processes in our bodies. And then you could do a few key labs such as a CBC, a CRP, markers of inflammation, maybe even a vitamin D for them to look at all some basic areas of inflammation, and starting there with your patients. Even starting in those basics can help your patients tremendously. Now, if you have patients that are on more of a moderate or higher budget, you can consider specialty testing for them, right? And this is really helping to underlie or uncover many underlying factors and drivers of their imbalances. This can be looking at things like a gut assessment and looking at a microbiome mapping, things like a food sensitivity or food reaction panel, or even advanced nutrient and metabolic profiles, right? And when you start to look at that at a deeper level for them, you start to make your treatment protocols even that much more precise for them. And even within the conventional primary care setting, right? Even these small integrative shifts, such as the nutrition that we were talking about, the stress support, the targeted supplementation, these can help your patients really reduce inflammation, regain their function, and really move toward lasting autoimmune remission. And that's the whole point here, is to bring their autoimmune expression down and to improve their overall quality of life.
Absolutely. And I'm glad that we're talking about this. And of course, we'll have a class more specifically later on this month, I think planned on affordability. And we're going to talk more about nutrition and diet in the how do we support our patients' dietary choices when they're on a small budget, right? So it probably wouldn't be for every patient that we're going to talk about the advanced specialty functional medicine labs, right? But the foundational things, there's so much that we can do to help those patients, right? From dietary, like you mentioned, lifestyle, supplements. We might pick supplements that, are on a more affordable side, or maybe narrow it down to just 1 or 2 supplements if that's all they can afford in every given month. But sometimes it's the things that, it's the most simple things, right? For example, as we talk about, changing someone's health on a budget, right? I have this, I'm just remembering this thing, and it's very random, but I'm got to share it. And I obviously don't want to offend, that person I'm going to talk about, so I'm not going to mention the name or anything that, but I used to go to a chiropractor, right? So I used to go like once in a while and get adjustment, and I still do go once in a while. And so I would go to the office, I would wait, I would go into the reception, I would say hello, and the receptionist was typically, if I would go in like early in the day, I would see them sitting there with Gatorade, the Gatorade drinks. It was one of those big Gatorade drinks. And this is like one of the examples of like, as you learn functional and nutritional medicine, you start to understand things like what is the impact of what they're doing right now to their body, right? And so when you learn about the impact of high sucrose and dextrose consumption, which is one of the leading very high very high in Gatorade, you start to understand that if you got a spike in insulin, you gotta it's associated with inflammatory cytokines, oxidative stress. It messes up with your gut bacteria, right? It's very pro-inflammatory. Now, add to that recipe, the Gatorade recipe, let's call it, yellow 5, yellow 6, all the artificial stuff that basically, while considered safe by the FDA, they are banned in other countries because they are associated with muscle activation, right? They're associated with behavioral, neurological changes. They're associated with inflammatory response in the gut, right? Now we're also getting into the artificial sweeteners that they're also adding, right? With the zero versions or G2, right? And so that's also, some of that stuff is also, some studies show, for example, that acesulfame potassium, for example, that's actually is associated with increased glucose intolerance, increases tumor necrosis factor alpha, right? And I can go on and on. The exosodium, the glycerol ester of rosin, like all of that stuff, they use as stabilizers and add-ons and chemicals. Like, it's a cocktail. Essentially, it's a cocktail of chemicals that just push our body towards more inflammation. And again, that's the epigenetic, right? So if somebody like that comes to see you and you're looking at their like 1 day dietary, like what they're eating, right? You don't need an hour session for that. You ask them to write down what they're eating on a given day. They bring it to you. You look at it. It takes like 2 minutes to see, oh, you're drinking Gatorade in the morning. Well, what can we do to replace that? Because it's got a lot of chemicals that are probably not good for you. You know, what can we do to replace? There's something else you might enjoy drinking, right? Sparkling water with lemon, right? Or whatever it is, right? It's like, what can we do, right? Maybe sparkling water, maybe just apple juice, just simple apple juice, right? So we got to think about what can we do to minimize the insulting factor for our patients. That's really what a lot of our focus is. And so for patients on a budget, it doesn't have to be fancy, right? Right? It doesn't have to be fancy. And that's really what Dr. Chill was trying to mention. So I wanted to show you this, share with you real quick how Dr. Chill is sort of what's the flow, the functional integrative medicine flow. We got a cool picture that we want to kind of share with you. And so it starts with stage 1 is like, as a clinician, learning, look at the patient's story, medical history, lifestyle, occupation, exposure, major concerns, right? When did it start? Right? When did it start? What happened during that time or around that time that their symptoms appeared or increased, whatever it is, right? Step number 2, we want to utilize the evaluation tool that the academy gives you to identify. That's step number 2, identify what are the factors that contribute to or trigger dysfunction using the evaluation form. That already does the heavy lifting for you. Okay, step number 3. Jacob, can you move to step number 2 and then step number 3? So that's the evaluation form. Now, step number 3, that is the health plan. Create an evidence-based plan using diet, supplement, lifestyle changes, right? Now, Tal, how would I found all of that, right? Well, the quick start guide that we're giving you has all the treatment protocol. So they got gut dysbiosis. Here's the treatment protocol for gut dysbiosis. Here's what lab to look for. If they got rheumatoid arthritis and they're coming to see you with pain, there's the phone app. Just type in the phone app, rheumatoid arthritis, and it pulls up the evidence-based strategies or supplement or whatever it is. Now you got a whole treatment plan made in like 5 minutes, right? Next is educate, which is where the magic happens. It's you explaining to the patient like what's happening in their body, what's causing it, according to what at least we can see, right? And then what do they need to do about it? And then they come in every 2 weeks to your practice. If you're doing it virtually, then you're sitting at home and they're connecting through the computer. If you're doing it in person, then that's fine. It's the same process exactly. But we want to guide and educate our patient. So one, they see you as now you are becoming the go-to person, and they carry that as, that's the biggest legacy, as I mentioned, for that. And of course, all of this, let's move to the next picture. All of this is found in the Advanced Clinical Functional Nutrition. So it's the clinical application, the evaluation tool. This month, we're also providing the treatment protocol phone app. That's all included for you. It's self-paced. You got coaching, mentorship with amazing practitioners that have helped so many practitioners in our community to do functional medicine successfully and open their own practice and be successful doing that. And then we also have live and on-demand workshops. So this month, we have an amazing workshop on the 15th, which is the Functional Medicine Clinical Summit. It's one day on Saturday. It's open to all our community members inside the Functional and Nutritional Medicine, the Advanced Functional Medicine. You actually get a ticket from us as a gift. And then we have another one that is coming where we build your functional medicine plan with you. That's the date for that one is going to be posted soon. So with that being said, it's everything you need to have to be successful, really help change patients' life. That's what we're here for. So I want to thank Dr. Chill for being here and sharing his, years of clinical experience and business experience.
Thanks for having me. It's always a pleasure.
And I want to thank our technical team, our media team for helping us to be here with you wherever you are, and so we can stay connected. And I also want to thank each one of you for building a sanctuary for your patients to get the answers that they've been looking for, and they're not going to get anywhere else. Remember, every additional strategy that you are learning can help the next patient tremendously, right? At the appropriate time, the appropriate patient, it could be a game changer, right? So keep on learning, keep on advancing your skills, and I really appreciate everything you're doing for your patients. We look forward to seeing you in our classes. We look forward to seeing you in our workshops, and we look forward to seeing you in our coaching with our amazing faculty. So take care for now and have a good evening.